Hey guys, this is Matt,
And I'm Hussein.
and we're going to be talking about the anesthesia circle system.
The circle system serves three basic functions. It's to deliver oxygen and inhalational anesthetic agents, also to eliminate carbon dioxide.
Here we have a schematic of the circle system, and this specific one can be seen in textbooks, and there are also other similar variations. But the circle system derives its name because gases flow throughout the circuit in a circular pattern, and this occurs through separate inspiratory and expiratory limbs. There are 7 specific components that we will talk about individually. They include the fresh gas inlet, unidirectional valves, corrugated tubing, Y-piece connection, APL valve, reservoir bag, and the CO2 absorber.
The circle system is the most widely used breathing circuit in the United States, and this is because how well it works. Advantages of the circle system include its ability to deliver low-flow anesthesia, greatly increasing the efficiency as well as cost savings. Additionally, the anesthesia circle system can be utilized in all age groups, permit scavenging of waste anesthetics, conserves heat and moisture, and helps reduce injury from barotrauma. While the disadvantages include the multiple components and connections that make up the circle system, increase the risk for misconnections, disconnections, and failure.
So we're going to go over each component, and we'll go in the order of which gas flows through the system. The fresh gas inlet, located here, delivers oxygen, air, nitrous oxide, and inhalation anesthetics to the circle system. The inlet is located upstream of the inspiratory unidirectional valve and downstream of the CO2 absorber. This ensures fresh gas travels down the inspiratory limb only during the inspiratory phase.
Next, we'll be talking about the inspiratory unidirectional valve, and I'll circle it right over here. The purpose of the valve is to permit forward flow of gas. The valve is open during the inspiratory phase, allowing fresh and recycled gas to travel down the inspiratory limb towards the patient. The valve closes during the expiratory phase to prevent gas from traveling backwards into the inspiratory limb, and this function prevents rebreathing of carbon dioxide. The inspiratory valve is located between the fresh gas inlet and the inspiratory limb of the breathing circuit.
After gas travels through the inspiratory valve, it then goes through the inspiratory limb of corrugated tubing. This tubing serves as the channel for fresh and anesthetic gases to travel towards the patient. There are standard measurements of this tubing, and this helps to prevent misconnections as well as minimize resistance to gas flow. The internal diameter of the tubing is 22 millimeters. The corrugations found along the circuit allow the circuit to bend without kinking, and this helps to prevent obstruction of gas flow. The inspiratory limb of corrugated tubing is located between the inspiratory unidirectional valve and the Y-piece connector.
The Y-piece connector is located between the inspiratory and expiratory limbs of the corrugated tubing, forming a single channel to the patient. During inspiration, gas flows through the inspiratory limb through the Y-piece and into the patient's lungs. During expiration, exhaled gas travels out of the Y-piece and towards the expiratory limb of the circuit. The Y-piece includes a 90-degree elbow attachment. This attachment can accept a 22 millimeter adapter for a face mask or a smaller 15 millimeter adapter for connections to endotracheal and supraglottic airways. The Y-piece connector is the most common area for disconnection to occur.
After gas is exhaled, it travels through the Y-piece and towards the expiratory limb of corrugated tubing. This limb serves as a conduit for exhaled gases to travel away from the patient. The expiratory limb is located between the Y-piece connection and the expiratory unidirectional valve.
The expiratory unidirectional valve permits the forward flow of gas while preventing reflux. During exhalation, exhaled gas causes the expiratory valve to open, maintaining forward flow through the expiratory limb. Remember, at this time, the inspiratory valve is closed to prevent gas reflux and permit the forward flow of gas. The expiratory unidirectional valve is located between the expiratory limb of the corrugated tubing, and the APL valve.
Next is the adjustable pressure limiting valve, or APL for short, and it's also called the pop-off valve. This allows the anesthesia provider to create an adjustable leak and control the airway pressure during manual ventilation. With closure of the valve, it permits application of positive end expiratory pressure, or PEEP. The APL valve is a sideline device of the circle system rather than a part of the inline path. It is located after the expiratory unidirectional valve and before the CO2 absorber, where it serves as the interface between the circuit and the scavenger. During spontaneous ventilation, the APL valve should be in the fully open position. If manual assistance is required, the valve can be closed and adjusted to achieve the pressure required to ventilate the patient.
There are three main functions of the reservoir bag. It serves as a chamber for supplemental fresh and anesthetic gases, permits manually assisted and controlled breaths, and limits barotrauma by regulating circuit pressure. The reservoir bag is also known as the breathing bag and can hold a patient's inspiratory capacity and ranges from a half liter to 6 liters. Reservoir bags are ellipsoid or hourglass shaped, making them easier to grasp. The reservoir bag also provides a visual and tactile indicator of spontaneous ventilation, a tactile assessment of lung resistance and compliance, and a mechanism for manual alveolar recruitment. The reservoir bag is located after the expiratory unidirectional valve, but before the CO2 absorber, and is in close relation to the APL valve.
The last component of the system is the CO2 absorber. CO2 absorbers eliminate exhaled carbon dioxide while conserving oxygen, volatile agent, nitrous oxide, and tracheal humidity. This allows for rebreathing of desirable exhaled gases as well as humidity, and this contributes to the efficiency of the circle system. The CO2 absorber is located after the APL valve and reservoir bag and before the fresh gas inlet. Within the expiratory limb, exhaled gas that is not vented through the scavenging system will travel through the CO2 absorber. After passing through the CO2 absorber, the recycled gas then enters the inspiratory limb, where it mixes with fresh gas from the fresh gas inlet. And this completes the flow of gas through the circle system. To wrap this up, we are going to summarize gas flow throughout the system. Fresh gases enter the circle system from the fresh gas inlet and travel towards the patient, passing through the inspiratory unidirectional valve. During inspiration, the inspiratory valve opens. At this same time, the expiratory valve is closed, and this prevents retrograde flow and thus rebreathing of exhaled gases. Opening of the inspiratory unidirectional valve allows a combination of both fresh and recycled gas to travel into the inspiratory limb of the breathing circuit. Gas then passes through the Y-piece connector and to the patient's lungs. During exhalation, exhaled gas travels from the patient's lungs through the Y-piece connector and to the expiratory limb of corrugated tubing. The expiratory unidirectional valve is open during exhalation, allowing exhaled gases to travel away from the patient. At the same time, the inspiratory valve is closed. Gas will then travel to the APL valve, the reservoir bag, and finally the CO2 absorber. After passing through the CO2 absorber, the recycled gas then enters the inspiratory limb, where it mixes with fresh gas from the fresh gas inlet. This completes the flow of gas through the circle system. Here we have a real-life image of the circle system. Feel free to pause the video and take a look at the image, trying to locate the 7 different components of the system. So here we have the image with the different components. On the top right is the expiratory unidirectional valve, located here. And right next to it is the inspiratory valve. The Y piece is located here. The CO2 absorber, this one's a little harder. It's hidden behind the circuit. There's also a backup absorber located there. The inspiratory limb of tubing is located here. Expiratory limb right next to it, located here. Reservoir bag, and lastly, the APL valve. The one component that is not visible from the outside of the machine is the fresh gas inlet. So we'll finish up the video with a knowledge check. The first question being, what are the three main purposes of the circle system? So these include delivering oxygen, delivering anesthetic gas, and the third, eliminating CO2. Second question, what is the most common site of disconnection in the circle system? And this is the Y piece. Last question, name 3 advantages of the circle system. So number 1, it is safe to use in all age groups. 2, it can be used to deliver low flow anesthesia, which can aid in cost savings. And 3, it conserves heat and moisture. This is the end of the video. We appreciate you guys watching.